Hello, YouTube world. Hello to my family, friends, subscribers, viewers. You know, like I said, always, welcome back to Rebirth. This topic that we're going to step into tonight. And before I even get there, I want to say happy Father's Day to all the men. Father's Day rolling up. So happy Father's Day. Guys, continue to be great fathers out there. Listen, ladies, allow these men to be great fathers. No restrictions. But you know there's situations that, but nonetheless, happy Father's Day. Moving on. The topic for tonight, and it is approaching 9 a.m. Medical mistakes. How can we avoid them? And I'm talking about the patients. See, I know how the medical professionals can avoid mistakes. Oh, we have a lot of things that, you know, they lay out there. You don't do this, you don't do that. Make sure you double check this, double check that. That's one thing. But what do a patient or a soon-to-be patient needs to do to make sure that they avoid these type of medical mistakes? And I have two stories that we're going to touch on just to give you an idea of how medical practice can go wrong just by a little something that they overlook, or whether it's by the doctor, nurses, or by the hospital themselves, their whole institution. How and the things, how and what can be done is the question. But for the lay members, for people, for just the patients, here we go. I will always tell you right now that if you want to avoid running into a bad doctor, research the doctor before you run into him. Research, 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 research. You know what? I believe in research. I believe in research so much until, yes, you can find stuff that's false, but let me tell you something, the majority of the research out there is true. You look up these doctors' names, you go to the proper websites, we're going to talk about that at the end of the video, and you look it up, you look it up, you look it up, you find out whether he or she, whether they have performed this surgery, how many times they've done it, have they been reprimanded for a botched surgery? You know, how many times they had a botched surgery? You know, have they prescribed the wrong medicine? How many times they done that? Because medical errors do happen. And just because they're a doctor don't make them God. So they're going to make a mistake. But what you pray and hope for is that they have the right core group of people around them in the emergency room or in the surgical room that is ready to say, oh, doc, no, think about it. We got to do this. We need to do this first. Because everything is moving 100 miles a minute, just like that, making decisions just like that on the fly. So you want a doctor that knows how to listen to his staff, the people around him, the people that supports him when things get real tough in the surgical room or in the emergency room. But let's not talk about emergencies right now. Let's talk about planned surgeries. A surgery that has been planned. Even we talk about the birth of a child that has been planned. You have two people to care about. You have the baby that's going to be born or the baby that's being delivered and the mother who's delivering the baby. So you got two people to care about in a situation like that. Now, in another situation, when you talk about just a surgery, for an example, you got to have a kidney removed. If it's not charted correctly, you will find yourself getting the wrong kidney removed because a nurse did not, she made an error by charting the left rather than the right. If the right is the one that has to be removed, then guess what? He's going to the left because that's what you put in the charts, left. And that medical error can cause you without two. Now you got to go through all these changes. You got another surgery that means another compound on top of each other. So that's what I'm talking about. Let's move on to my two incidents that I picked that I feel like that will really touch on something for someone out there that's watching this video. A writer in the MedPage Today, a writer for the MedPage Today wrote this story, and it's about parents of a 4-year-old who are suing a Texas Children's Hospital in Houston for giving their son an unintentional vasectomy. Yes, you heard it. A 4-year-old receiving a vasectomy. Yeah, I'll say it one more time. The hospital surgical doctor gave the wrong surgery. He performed the wrong surgery on a 4-year-old infant child. It should have been a hernia removal, but removed too much tissue, which went into another area of the scrotum area and caused a vasectomy. Let's get into this right now. During the surgery for a hernia removal, the doctor also caused a vasectomy. What is a vasectomy? Vasectomy naturally means sterilization by surgical cutting and sealing part of each vas deferens. So when she was removing the hernia, she also went into the vas deferens and removed much a part of that as well, which leaving the child sterile. Moving on. When we ask why is that so important when we talk about the vas deferens, the vas deferens perform a certain job in the sex organ of a man. It is where sperm is transferred from. That's where the sperm goes to, because the vas deferens sends sperm. So what it does, transfer the sperm to the urethra, collecting secretion from the male accessory sex organs such as seminal vascular, prostate gland, and bulbourethral glands, which form the bulk of the semen in a man. That was cut away during the surgery, leaving the child sterile. This happened in August 2021, when they noticed that the scrotum was swelling, but the continuation of the swelling is what caused the alarm. So the doctor, Susan, she noticed it, and she diagnosed that the right side of the hernia of the right on the right side was swollen, needs to be removed. So now she has to go in and fix it. When the hernia sac was sent to pathology, they sent back a report saying, guess what? Yeah, you did take away the hernia, but you also took away part of the vas deferens. And that's the oh my God moment. Because now you have just gave a 4-year-old a vasectomy. So According to this, the lawsuit report also presents tissue from the vas deferens in the specimen, which the lawsuit alleged amounts of tissue that leads to confirming a vasectomy. The Harris County District Court lawsuit alleges that Dr. Jarosz was negligent in providing medical treatment by not properly distinguishing or separating the hernia sac from the vas deferens before removing the hernia sac surgically, failing to carefully operate with resections to the vas deferens tissue, failing to comply with safety protocol, and failing to maintain applicable standard of care. There's no way to put it, people. My question to her, once she said, there's a hernia and I must remove it. Have you ever done it before, ma'am? Have you ever removed a hernia? She may say yes. I'm saying from a 4-year-old? Because a grown man, that's different. A 4-year-old. Have you done it to a 4-year-old before? If she say no, ma'am, I thank you very much, but let's go ahead and start calling referrals in. I want to meet with other doctors that have done this to a child this small. Because you can't request that. That's your right, patient's right. Especially for a child, because guess who's speaking for that child? The parents. You have to do your due diligence. You have to do your due diligence. If she had never performed the surgery that serious on a child, it's time to find someone who has. At least someone that can come down, at least 5-year-old or 8-year-old. Come on, let's get close. But we oftentimes find ourselves rolling with a situation because we give credit because of their medical training, the years they put in school and everything. We say, okay, I know this person. Yeah, she got to be good at this. She's a doctor. That's not always true. Do your due diligence. Unless it is an emergency situation where it's life or death, and it has to be done right then, you find someone else to do it. If that person deems not qualified enough to do it. Do your due diligence. I would request for another doctor. I would request a referral. I need a referral to a surgeon that specializes in this area with children. Is that there's a such thing? Can I go find that? Yes. That's what you need to do. Because that baby's life and that baby rest of his life is in that doctor's hands for that time that doctor is cutting on that child and removing whatever needs to be removed. Think about it. See, we get around here and we think that, hey, we give them credit, nothing wrong with that. But you must do your due diligence. I say that again. There are a few sites that you can go to. Anybody can go to these sites and you can look up doctors. You don't have to, you know, it's good that you can get information from a medical practice, you know, a hospital, but you can always, the internet now is wide open. Come home, look it up, find out what doctors does perform this type of surgery on children, on young boys. And then you go look it through the names. Once you find a name, you can go to healthgrade.com at grade doctors. Healthgrade.com is a website where you can go and you see the grades of the doctors. In other words, you're like you getting a grade from school. They get graded as well. Healthgrade.com. Another one is ratemd.com. ratemds.com. Go to that website. You can find out who rated the MD, why they rated them such. Is it a hospital? Is it another doctor? Blah, blah, blah. Goes on and on. You can find out about these doctors' background, what they have done, how many surgeries, what type of surgeries, what their specialty, everything. You go look it up. Another one, vitals.com. You go to vitals.com and you can pull it up and you can do the same. Some out of all three of these websites, one may have a feature that the other one don't have, but guess what? You can go and find out what you need to find out from these websites. My people, my YouTube family, let me tell y'all something. Do yourself a favor. Do yourself a favor. When you start having problems, start looking up doctors. You can do this way before you really need it. If you know that you potentially have these problems, I did that myself. I had a situation where I was all up in Georgia looking at doctors. And then I ended up finding the right one in Lake City. Not Tallahassee, not Jacksonville, not Shands, Gainesville. I found the right one in Lake City. And the good thing about it, he was the type that didn't rush to judgment. Took his time, look over things. Okay, Robbie, let's go here with this. Let's do this. Let's do that. Try this, try that. One trying to throw me on medication and all this and stuff. And I'm only saying this because there's going to be a time where you're going to need to know about your doctors. And you don't want to wait until after you're harmed by one, and then you want to go and get a lawsuit. But then again, you may lose a loved one in the process, which is most important, the money or the loved one living. So let's stay with being on top of the dirt. Let's stay with keeping people alive. Let's stay with the Hippocratic oath, do no harm to no one. I would do no harm to my patients. I will not do it. See? So let's stay with that. I want to thank you again. Go subscribe. Look at that subscribe button. It's all red letters, subscribe. Click the notification bell. Check me out. Go and look at some of my other videos. I have a lot going on and I'm bringing more. This is Robbie Williams, founder of Rebirth, my YouTube channel. And I would like to say, God bless you all. Happy Father's Day and good night.